Welcome everyone to this inaugural Vivek Murthy Distinguished Lecture Series on Public Health Leadership. This lecture series is in celebration of Asian American Heritage Month, and this is organized by Federal Asian Pacific American Council, also known as FAPAC, chapters, and National Institutes of Health, and various other entities such as APOC and the AAPI groups from FDA, CDC, and HRSA. My name is Reena Das. I'm a program director at the National Institute on Minority Health and Health Disparities. We know that the health of population in the world is dependent upon our public health leaders. So today's event is incredibly meaningful to the AAPI community because today we have with us US Surgeon General Vivek Murthy and National Academy of Medicine President Victor Zhao, two very important public health leaders to inspire our next generation. So to start us off, it is my distinct pleasure to introduce Dr. Eliseo Perez-Estable, the Director of National Institute on Minority Health and Health Disparities, who will provide welcome remarks for the event. Dr. Perez-Estable, it's all yours.
Thank you so much, Reena, and thank you for being just relentless in organizing this event. It took months. You and Shinji, Zhao, and other participants in organizing this. So I want to welcome everyone to this inaugural Vivek Murthy lecture event in celebration of Asian Heritage Month. Let's keep in mind that Asians make up about 60% of the world's population, I think, about 6% in the United States. May is Asian Pacific American Heritage Month, and is a designation dating back to officially 1992 when Congress approved a law to put this into statutory files. So our goal is to really bring leaders to talk about public health and talk about in having issues around enduring significant impact in advancing public health. We're really privileged today to have an opportunity to hear from Dr. Murthy, who is now our Surgeon General in the current administration. And we're really delighted to have you back, Dr. Murthy, and I'll look forward to working with you, as many who spoke about having that opportunity before. In my time at NIH, I think we didn't overlap very long. And then Dr. Victor Zhao, who is a distinguished physician scientist, internationally recognized cardiologist, and has been a visionary leader as president of the US National Academy of Medicine for their efforts in public health. And we really want to have this be a conversation. We're going to, of course, going to talk about COVID-19 and disparities and root causes, but I think there's a lot of interest in talking about mental health and issues that are affecting us as a consequence of the pandemic and lessons learned. So without further comment, I want to turn it over to Deputy Director of National Institute on Minority Health and Health Disparities, Dr. Monica Webb-Hooper, who will be the moderator for this conversation. Monica?
Thank you, Dr. Perez-Estable, and welcome everyone. I am delighted and honored to moderate this inaugural event. Now, I know that this is the Vivek H Murphy Distinguished Lecture Series for Public Health Leadership, so you might be expecting to hear a lecture or a formal presentation, but our guests thought it might be more interesting to have a fireside chat instead. And I thought this was a terrific idea and one that would allow for a more informal conversation, give us an opportunity to learn about these distinguished individuals in a different way. To hear their personal reflections on past and current events, and allow us to incorporate questions from the audience. So you've heard a little bit about our distinguished guests already, but allow me to introduce our guests by sharing just a little bit more, a small selection of their tremendously impressive careers. So Dr. Vivek H Murphy is the 21st Surgeon General of the United States as a returning role, previously serving as the 19th Surgeon General. As the nation's doctor, the Surgeon General's mission is to restore trust by relying on the best available scientific information, providing clear and consistent guidance and resources for the public, and ensuring that we reach our most vulnerable communities. As the Vice Admiral of the U.S. Public Health Service Commission Corps, Dr. Murphy commands a uniformed service of 6,000 dedicated public health officers, serving the most underserved and vulnerable populations domestically and abroad. And our honoree today, Dr. Victor Zhao, has provided distinguished leadership in health and medicine and the global response to the COVID-19 pandemic. He has led the National Academy of Medicine's response to COVID-19, including major contributions to key reports, consultations, and communications on a range of issues, including public health, vaccine allocation, health equity, and mental health. And he has worked tirelessly to engage with the global response to COVID-19 by providing leadership as a member of the Global Preparedness Monitoring Board, also as co-chair of the G20 Scientific Expert Panel on Global Health Security, advisor to the G20 High-Level Independent Panel on Financing, and a principal of the ACT Accelerator, which includes COVAX, the global collaboration for accelerating the development, manufacture, and equitable distribution of COVID-19 vaccines. Doctors Murphy and Zhao, welcome. So let's move directly into this conversation. We are celebrating Asian Pacific Islander Heritage Month, and it would be great to hear about both of your personal experiences growing up as immigrants and part of the Asian American Pacific Islander community in the United States. So Dr. Murphy, may I ask you to share a little bit with us?
Sure. Well, thank you so much, Monica, and thank you all to all who put this time together today and got this lecture series going. I'm so thrilled, really, to be joined by a dear friend and a man who I've admired for a long time, Dr. Victor Zhao. So glad we're having this conversation, and to have it now in May, in particular, which is the API month, if you will, feels especially meaningful. Being, part of the Asian American community was a really important part of my life growing up. My parents came to this country when I was 3 years old, and my sister was 4, and they were, really, they came for the same reason that so many other immigrants do. They were hoping that their children would be able to grow up in a country where we were judged not by the color of our skin or the fact that we were from the wrong caste in India or that we, had funny sounding names, but that we'd be instead given a shot based on our willingness to work hard, based on our ideas, based on our character. And by and large, we were blessed to find so many people who embraced us when we came to this country. And we settled in Miami. That's where my father set up a small medical practice. It's where I spent all of my years through high school. And I found teachers who really looked out for me. We had neighbors who took care of us. My father and mother running a medical practice also became like family with their patients, and those patients looked after us in so many ways as well. With that said, it wasn't always easy. The vision that my parents had, while it was often true, there were cracks in that vision at times. Like we had to deal with our share of discrimination and racism growing up from people who didn't understand, where we were from. Being from East Indian heritage, I was also always, people were generally confused. What they used to ask me, "What kind of Indian are you?" And would assume that I was American Indian or from our Native American communities here, which was fine in and of itself. But then I would get the stereotypes, from both sides, if you will. And so as a little kid in 3rd and 4th grade, trying to make sense of all of that, it was confusing. It didn't always feel good. But there were these moments like that made me feel like an outsider at times. And what's funny is that even though they seem small in comparison now, those experiences as children, they really stick with us in many cases. I remember very much, particularly one day in 4th grade, bringing this sweet, an Indian sweet called jalebi, to my mother had made at home, bringing that to the class. And when people had birthdays, people would bring cupcakes or various other foods. So I thought, wow, then people may really love this dessert that my mom made. So we made enough for the whole class and we brought it in. And I remember many of the kids were like, what is this? This is so strange. It's a funny color. It tastes like plastic. I don't know what this is. But it was one of those moments where it was like, it reminded me of how different perhaps my experience at home was and my family upbringing. But the last thing I'll say is just the role that the AAPI community played for me during those years, which is, a really important one at a time where I was trying to process my identity, understand where I fit in, make sense of perhaps some less enjoyable and insensitive moments from others when it came to racist remarks and stuff. When I was trying to make sense of all of that, it was extraordinarily helpful to be a part of a community of fellow AAPI immigrants who understood those experiences, where I didn't always have to explain, why my name didn't sound like everyone else's. And it was a reminder to me, even now to this day, that we all, regardless of whether we came here a few years ago or a few generations ago, we are all going to have difficult times where we wonder whether we fit in. Maybe it's on the basis of our race. Maybe it's because we came from a different socioeconomic background. Whatever the reason may be, we all have moments where we feel like we don't fit in. And having communities that can help us feel seen and heard and understood, they can help us realize that the pieces of us that may feel different are not, in fact, parts to be rejected or cast away, but in fact, are one of the greatest values that we bring to this country, which is a diversity of background, of culture, of ideas and faiths. Those kind of communities are invaluable. And I feel very blessed to have had that kind of support when I was growing up.
Thank you so much for sharing that. It is amazing how all these experiences really do stick with you. I completely resonate with that. Dr. Zhao, as you reflect on this question, what kind of experiences come to mind for you?
Well, first of all, I have to say I'm truly honored that I'm with Vivek in the inaugural lecture series. What a great personal pleasure. Vivek and I are good friends, but I also have great respect, of course, for NIH, minority health, equity, and of course, importantly, the Asian American Heritage and the Federation of the Asian Pacific American Council and all the others for sponsoring this. It's just wonderful. And as you remember, when I was invited, this is now before Vivek got reconfirmed, I was supposed to give a lecture. I said, okay, what are we going to talk about? But I think this conversation, which I'm truly looking forward to, is just a great idea. So I was born in China and was born in Shanghai. And when young age, 5 years old, a little bit older, we fled China as refugees because of communism and went to Hong Kong. Certainly I experienced in my childhood a lot of poverty, illness, disparities. I can't begin to describe to you, but I was one of the fortunate ones that at age 18, my parents put enough money to send me off to schooling in North America. And my first experience with discrimination was the fact that I wanted to come to the United States and I wanted to go to Australia. And at the time, certainly Australia had quote an all-white policy and Chinese were considered colored. So I ended up in Canada, much to my fortune, to study at McGill. So I would say that initial experience in trying to come to a new culture altogether and learning so many things which is so different than the way I was brought up. I can tell you stories after stories. I was in fact a very reserved individual who only speak up when asked. And of course, that's not the American way, but that is the Chinese way. So, I'm always think about through my career in going from Canada to Boston, where Vivek and I both have, this person we look up to, Eugene Braunwald, who gave me a shot to be a resident at the Brigham Women's Hospital. So I think about the Chinese proverb, if you want 1 year prosperity, grow grain. If you want 10 years of prosperity, grow trees. But if you want 100 years of prosperity, grow people. And I think that's been the story. I've been given so many opportunities along the way of people who are enlightened. And I feel the same way about people I work with, growing them, enabling them to succeed. But I say grown people goes beyond the immediate circle. It's your community. It's the people that you work with. And that's why I think Vivek and I are so, shall we say, committed to the whole issue of equity and public health and population health. With regards to my experience, well, there's no question in my early years, I felt so different. You know, aside from not knowing even how to take a bus and knowing when to speak up or not, I had to do a tremendous adjustment. People used to think that I was, shall we say, non-social. But the adjustment to culture and the language, and then to get accepted, particularly when you go to a place like the Brigham or Harvard with smart people coming from different backgrounds, was not easy. But I think the important thing I had to learn was how to be heard. And that's certainly, I know that all of us have faced this issue, right? So I think those were some of my early experiences in trying to get through to where I am today. I would say a lot of people helped me, but there's no question there's bias and racism. I have to overcome lots of them. But I think eventually I learned how to adjust and blend in my own culture with, in fact, what's expected also in a white dominant culture.
It's great to hear about your families and where you were born and raised, and some of the things that have happened along the way. And Dr. Zhao, you shared a bit about your career challenges that you've experienced along the way and your commitment to mentorship and growing the next cadre. You both have amazing careers. And most people, of course, have challenges along the way. Dr. Murthy, do you have anything to add specifically about your career path to this point? And when you think of challenges, the most significant experiences that come to mind?
Well, it's a great question. Actually, Monica, before I answer that question, can I ask Victor a question that you made me think of? Victor, so when you were going through those experiences, I mean, coming to McGill, for example, and like this, which must have been just such an extraordinarily, well, profound, amazing, traumatic experience to be in a completely different world. And when you're encountering like those examples of, you know, feeling sort of like an outsider or people making assumptions about you, or maybe even making offensive comments, you're like, who did you turn to? What did you do for relief? Because obviously your family wasn't with you at the time.
Yeah, it wasn't easy at all, because this is back in the late 60s and early 70s. You know, we didn't have iPhones. In fact, Vivek, we used a landline that we would call my family once a year. And we'd be looking at our watch to say 10 minutes, it costs too much money. It's a real story, right? And I mean, probably people of my generation will tell you the same story if they're from, you know, Asia and elsewhere. I thought I may never see my parents again after I'd gone to North America. I don't know if they ever will be able to travel, and certainly air travel was not one of the things we do every day like what we do. But, you know, I did have good mentors. I can't say that I can call them anytime, but I know they're always there for me. And we had people who looked at meritocracy. You know, you and my friend Tom Lee wrote about a book about Dr. Braunwald and how he believes in meritocracy. I did have good friends who I can turn to, and of course, later in my life, my wife. But I think there were many moments that was very challenging, difficult. I can tell many stories about Christmas and New Year's in my own room, in an apartment, tiny little room, and others going through this. But I think all these were, I think, necessary experience, and I think it's made me a better person, but also allowed me to understand what flexibility, resilience is all about. And I have to say again, along the way, because of many really people who saw the potentials of a young man from China, that I got to where I am. So I'm awfully appreciative of those individuals.
That's amazing. That's amazing. And I'm gonna answer your question, Monica, but Victor is making me think about is just how many of those people out there, and sometimes with just simple, small gestures in those moments of pain can make you feel seen and heard, and they themselves may not even realize just what an impact they're making, like on our lives. And I try to remember that for two reasons. One, because there are so many people like that that like I've been blessed with to encounter in life. Like I remember in woodshop in 7th grade, I'll never forget this guy who terrorized me for like 9 weeks, just bullying me about like my, you know, my sort of Indian heritage, this, that, and the other. And I was like, you know, as a shy, you know, kid, I really didn't know how to push back against that. I don't know what to do until this one kid in the class, Eric Fong, I will always remember him. He finally one day couldn't take that anymore, and he came and he actually stood up to that bully. And at a time where I, you know, as a young kid, like didn't feel like I knew how to stand up for myself. And he may not ever remember that, you know, it was like a blip in his life. But I will always remember that because, but that's a power, I think, what we can do in other people's lives when we see folks struggling. Monica, your question about like public, you know, career challenges, you know, like, look, I feel extraordinarily blessed. I've had amazing opportunities, the kind of opportunities my parents really only dreamed of when they came to this country, and I feel extraordinarily blessed because of it. But that doesn't necessarily mean that life went the way I expected. And there were many times where I had a lot of pushback for the things I wanted to do in my career. When I was 17, for example, and I was starting my first nonprofit organization with my sister, and we were doing HIV work in India, we had zero expertise in health and HIV and building organizations. But what we didn't have in expertise and experience, we made up for in passion and creativity. But there was a lot of pushback from people who said, well, why are you doing this? Why don't you wait until you get some training to actually try to build an HIV, you know, education organization? And thankfully, there were enough people who encouraged us that we were able to move forward. But I found at many points in my life, I was doing things that I was not trained to do. Like when I began my first technology company, I had no background in technology, but I saw a need that I thought needed to be met to bridge gaps in research, to enhance collaboration, to improve clinical trials. And that was true in when I built my first grassroots you know, advocacy organization in healthcare. I had zero experience doing that either. So that was always a source of pushback. Like, are you really qualified to do these things that you're doing? And one thing I try to always remember, a lesson I hope I never forget, is that when you're young, sometimes what's the advantage you have is you don't pay attention sometimes to those things, but also you don't know what you don't know. You just know you're excited about something and you just try it. And I think that if I want to always like try to maintain that, you know, sort of desire to just keep trying, even if I don't have expertise in something. The other barrier that I face actually has been around my age. So like when I was young and my sister and I were starting our first group, people also said, not just, you know, you don't have experience, but you're really young. Why don't you just go back to school? Like, why are you like doing all this other stuff? Just focus on your studies and your academics. Even when I was nominated the first time to be Surgeon General by President Obama, I was 36 years old at the time, and many people sort of serving as Surgeon General, like what's going on here? And so there were many circumstances like that where I felt that because of my age, I was being told I couldn't or shouldn't do things. And lastly, I'll just say there were times when I also thought I wanted something professionally and didn't get it, and then later realized it was probably for the best, and that it taught me something. So one classic example, it's actually Victor, like after you left the Brigham, and Victor, just, you know, Victor and I first crossed paths at Brigham Women's Hospital in Boston. He was my chairman actually in the Department of Medicine when I arrived there as a trainee, as an intern, and someone hence who I've admired for a long time. But after years of working at the Brigham, I actually thought of applying for a promotion. I was an instructor in medicine at that point, and I was applying to be an assistant professor in medicine. And I had been at the Brigham for probably 7 years as a faculty member. I had done a bunch of things which I thought, you know, ticked the box in terms of what their criteria was for having a statewide sort of a reputation and impact, and what all the other criteria that promotion systems have. And I remember, and my chair, you know, the head of my division also thought I had a very good shot of being promoted. And he said, this won't be a problem. He's like, his question was, should you apply for the associate level? That was his question. So much both of our surprise, I remember the day that I got the message that said I had been rejected from being promoted to assistant professor. And I was really disappointed and saddened by that. Now, even though like I knew in my heart that I had made decisions to work on various things, you know, because they were meaningful to me, building, you know, advocacy organizations, companies, doing other stuff, providing clinical care, doing a lot of teaching, which was really I was passionate about. but I was really sad. I was disappointed. I felt like it was an indictment about my worth and value, like in medicine. Now, 3 months later, actually, it was when the president and his team reached out about serving as Surgeon General. So I had an alternate career path there, and I took that path and was grateful to have the opportunity to serve. But my point is that, like, in that moment, getting rejected from being promoted was almost, it felt like a rejection of me, because, and that's like one of the things I find is most challenging, but most important for me personally, is to make sure that the expectations that I'm setting, the destinations I'm driving toward are driven by me, by my values, by my passions, and by my priorities, and not by society around me or the expectations of institutions or sort of broader culture. It's not always easy. I don't always succeed. I have moments where I take on the expectations of others and feel disappointed when I don't measure up. But that lesson stands out to me as one of those moments that reminds me that, hey, we've got to develop our own destinations, go at our own pace, figure out the path that means the most to us. Because at the end of the day, there are too many people, I think, whose lives end up getting driven by somebody else. And this is our one shot to really drive our own life.
That's fantastic. As you were both speaking, and as I'm reflecting quickly on what I'm hearing, I heard quite a few similarities in what you shared about your life experiences. So here's what I wrote. So I heard themes such as perseverance, managing doubt and insecurity, both professionally and personally. I heard about seeing a need and working to make it happen. I heard about risk-taking, personally and professionally. I heard about keeping things moving and advancing, even when it seems challenging or feels impossible. I heard about holding on to personal values and developing your own destination while maintaining a sense of appreciation and gratefulness. That's my summation of what I've just learned.
Wow.
We've made in
That was fantastic.
making
Very
sure
impressive.
I tell you.
functioning and
Okay, well, I want to change the conversation a little bit. That was fantastic, but let's talk about the past 15 months.
By the way, I do want to say,
Oh,
Monica, I share with Vivek many of the similar experiences and traits. Certainly our life is full of rejections. You don't see it. But along the way, I've been rejected many times. I agree with Vivek about, passion. And I agree that, we tell the young people, don't even try to engineer your career, because you do the right thing, you follow your passion, the right doors will open. The only thing I disagree with Vivek is age. He says when he's looked at younger, 30 some years old, well, I'm older, and people are wondering, why is this old guy hanging around? Thank God for President Biden. We now know that old people can work well too. Although I'll never admit I'm old.
That's great, Victor.
that's great. Okay, so let me move us along a little bit in the conversation, because I have a few other topics I hope we cover, but if we don't, we'll see how things go. This is really fascinating. But I do want to talk about the pandemic a bit, because over the past 15 months, give or take a few weeks, we've all just been through so much. And the pandemic has affected everyone in multiple ways. So I'd like to start this time with Dr. Zhao telling us about your experience personally, within your family, your community, and also how the pandemic has affected you professionally.
Well, I would say this pandemic certainly has affected many, many people. For me personally, people around me, that is families, people work at my work, and my community. But I'm really one of the lucky ones, because many people suffer far more than me. I just want to make sure we understand that. So that being said, I would say that everybody knows that, being socially distant, being mainly working in the same place, not having enough social interaction, I would say it's very difficult. It's difficult for me as a person. It's difficult for people who work with me. I would say the virtual working does not respect any time or personal space. And so I do know that people who work with me sometimes feel a tremendous amount of demand and if not burnout. People like my daughter, people possibly like yourself, Monica, and others, who have both childcare responsibility, work responsibility, trying to juggle parenting and work has not been easy. And of course, losing social connection and losing dear friends. In this pandemic, I lost a relative and a very dear friend. And it was very difficult not being able to connect with them and being able to show your compassion and be able to do something about this. But I would say the one that's troubling to me is the impact on my community. Today, and almost all the past year, I am in Durham, North Carolina, because that's where my family lives. As you know, I was a Duke for a whole number of years. So I've been working here, and of course, I'm very connected to my community. It's really difficult to see people losing their jobs, their homes, the effect on mental health and many others, and particularly Durham, which is a diversified community, 50% are non-white, people of color suffering. And that's difficult. And in particular, for me, I've been very involved with the community during the time I was the CEO, but even now, I co-founded an organization called Made in Durham, which is meant for youth, but particularly those who are marginalized or disconnected. During this time, we all know how much learning loss there was for all the youth. And through CARES dollars and others, certainly the public schools able to provide as much possible laptops, devices, but this whole group of disconnected youth had no connection. So we went to work and raised money personally also, but also working with institutions, companies to provide them with devices, to also get hotspots to let them be connected again. And then, of course, there's a whole community issue that I feel that academic centers, including Duke, are not as well connected as to public health, Department of Health, and being to work with the community issues. And finally, of course, Vivek and I care a lot about the frontline workers, the clinicians. And during this time, we heard lots of stories. No people were burned out, and I'd like to talk about that later on. But certainly, issues that are enormously painful to watch people, facing this moral injury, facing burnout, maybe leaving the profession altogether. And so these are very tough times. I would say, all told, I won't want to live through this again. But if we have to, we certainly will have to work through this and make a better world.
I agree. Working through it and making a better world. I want to follow up on one of the components of what you shared just then, because I think that one of the unequivocal aspects of the COVID-19 pandemic experience is the undue burden among communities of color. And there's been much discussion about this, as well as many thought pieces written about the reasons for these disparities. So from your perspective, Dr. Zhao, what are some of the root causes for health disparities in COVID and more broadly? And then with that, what would you suggest in terms of strategies that could be implemented to prevent and mitigate these disparities as we all are trying to advance health equity?
Yeah, we have to confront the root causes, because people talk about factors of living conditions, their work conditions. Many people of communities of color, vulnerable, have to take jobs that nobody else would do. They can't sit in a room like I do in front of a Zoom. Frontline workers, lack of access to healthcare, comorbidities. But the root cause is systemic racism. Let's call it out. We know that this is years of inequity due to racism, due to bias, and due to the barriers. So I would say that if one were to really get down to this, we really have to tackle the social economic inequities, the determinants of health, and issues such as this. So for example, I would say that once we need to recognize that many of the policies, conditions, etc., are inequitable, and they need to be overcome. But for the pandemic itself, access to public resources, such as testing, make it free, make it easy to communities of color, make it available without a prescription, and so on and so forth. We also need to collect much better data. To date, I think the racial demographic data is really poor and fragmented. It's not until more recently that people push for this when you realize what a disparity. And I would like to, at some point, talk about Asian American, Pacific Islander and that issue as well. And of course, we need to make sure that the safety net organizations, the community health centers, et cetera, remain open, available to help the people. But most importantly, we need to gender trust engagement with community and communities.
That was excellent. Dr. Murphy, what would you like to add in terms of your thoughts about disparities in COVID, strategies to eliminate them, and health disparities more generally?
Well, thanks, Monica. No, I think Victor laid it out beautifully and compellingly, and he's absolutely right that this is more than like a checkbox issue. One more issue in the set of health challenges that we have to work through. Whether or not we allow disparities in health to persist is something deeper about the values that we want to live by, as a country. Again, one of the reasons that my family and so many families came to this country, whether it was recently or generations ago, was because we believe this is a place where all people would be treated equally, where we would all have opportunity. And the reality is that while we have made so much progress in that direction, that there are still millions of people who don't have equal access to opportunity, who don't have equal access to health and to health care. And we saw, that prominently displayed in COVID, right, with the disparate death rates and hospitalization rates that Black and African American, American Indian, Native, Hawaiian communities experienced. We saw it, on display even with disparities in testing. And these are complicated, right? Because this is a place where race and education and economic status are also intertwined here, and is often the product of years and years of structural factors that have led to these kind of disparities. So if we really, addressing disparities it's not as simple as just getting vaccines, to communities of color, or getting testing to communities of color. To really address it means looking deeply at how our society functions. Like, how do we actually get good education to people of all socioeconomic backgrounds? How do we make sure that there's actual economic opportunity for people across our country, and not just for the privileged few? Because so many of our health disparities end up being rooted in economic issues and in social issues and issues related to housing and education. The last thing I'll say is this: I think we have to be, I think, careful and intentional about how we communicate about this to the country. Because when we talk about equity, there are many people who feel heard when we speak about equity because they've suffered the results of inequities for very long. And there are others who may react very differently to equity, who may think that we are blaming them for inequities. And the truth is that if we want to move forward, we need the whole country to recognize that this is the direction that we need to go in, a place where, again, opportunity, education, economic prosperity, and health are available to all and not just to a few. So I think we have to just be mindful as we speak about this in public spheres that language matters here, that everyone may have a different understanding of words like equity and disparities, et cetera. And so we shouldn't, I think, always presume that everyone's on the same page, but just, I find it helpful. And this is true when I was surgeon last time, I realized as I would go to communities across the country that people would react very differently, to certain words. So sometimes just going in and talking about the challenge that we see before us, trying to get closer to the values that we know many people share around, equality of opportunity and outcomes. Like, sometimes that can be a good starting point for us as we try to build a larger movement in our country toward the kind of equitable outcomes I think that we all desire.
Mm-hmm.
That's fantastic. Mm-hmm. Here at NIMHD, we are part of that movement from the scientific perspective. And so the things that both of you shared with regard to naming the problem and the root causes and the complexity of addressing them are very important. And I certainly see health disparities as modifiable And so that always means we have opportunities for change, and getting everybody on the same page is something that we're all working toward. I do want to come back to Dr. Zhao. You mentioned something that was important, and well, many things that were important, but one thing I want to follow up on at the moment, when we look at national data on COVID-19 cases, hospitalizations, and outcomes by race ethnicity, we see that these data for patients identified as Asian American do not show disparities. And experts who work with and serve Asian American and Pacific Islander communities are speaking up to say that there are indeed disparities across these diverse populations. So would you help us understand? Oh, there's my little friend again. He's not waving at me today.
You want to wave?
Yeah.
Okay, there you go. My 4-year-old son, Tejas, he joins for most of my calls.
He's adorable. Happy to see him.
Be it recorded that there are 3 people in this conversation, 4 people, including you, Monica.
That's right. Okay, so Dr. Zhao, would you help us understand what about this? Are Asian American and Pacific Islander communities also disproportionately impacted by COVID-19? And what needs to happen in terms of promoting accuracy in reporting and data disaggregation?
Well, I think you said it right. I think that there's really been poor collection of data and no systematic collection. And particularly when you look at race and ethnicity, I think that we all know we have a long way to go to really truly understand what the issues are. But let me give you the following information. First of all, if you look at case fatality rates of COVID in Asian populations, it's been recorded at least in several cities and counties, 3 times higher in California, such as Los Angeles, San Francisco, and others, but also Chicago and others, where data are collected, 3 times higher in Asian Americans than the general population. In the city of San Francisco, Asian Americans comprise about 12% of the case infections, but about 50% of the fatalities. So I think there, in fact, the data, although not collected systematically, but now collected in different spots, it's very clear that's the case in my mind, but we need more information. But the thing that bothers me is that people don't think about Asian Americans, Pacific Islanders as a group that need to be looked at very carefully. Even in our National Academy of Medicine vaccine allocation report, that vaccine allocation study, which I actually brought, it was pointed out that when they talk about communities of color, Asian Americans were not included. So I do think that it's important for us to remember that when we think about vulnerable populations, communities of color, that we need to think about all of the above. And I don't think anybody did it for any bad reason, except there's no attention to this issue. There's no collection data. So we often think about as the model minority. I think this stereotyping really creates a wrong impression because Vivek and I, better educated, better income, but there are large portions of Asian Americans who live in terrible conditions, who have low income in Chinatown, Koreatown. And in fact, when you look at actually NPR just have a set published this morning, the data. And large number of Asian Americans actually are recent immigrants and also illegal immigrants. And some 30% don't speak the language. So they're isolated in their own culture. They don't trust, as you know, the healthcare system. I think those are some of the same issues as African Americans and others face, the kind of systemic racism that they face. And I do think that we have to call it out and to say we really need to pay attention to, I would say, not only Asian Americans, Pacific Islanders, but all races, because I think we all have the common experience. We don't live in the dominant culture. Dominant culture is a white culture, and sometimes this information is not gathered properly.
Yes, I mean, that you brought up actually a question that I had for you. And Dr. Murthy, I'd like to bring you in on this topic. And as I'm sure you're also overly aware of the myth that Asians are the model minorities. And that's a stereotype that has just been around for so long. And, I've been a part of conversations where people are pointing to data indicating that even with the relatively strong representation of Asian individuals in STEM, science, technology, engineering, mathematics, and medicine, that the overall numbers don't tell the full picture. And I've pointed out that Asian American and Pacific Islander communities tend to be underrepresented in leadership positions in these fields. What are your thoughts about that?
Well, Monica, I think you're absolutely right that they are underrepresented. And what Victor said is really spot on. Like it's an unusual experience, I think, for many Asian Americans of both existing in large numbers, but also feeling invisible sometimes. Invisible in the statistics and the data, invisible sort of in the priority, sort of in addressing sort of critical health needs and disparities in the Asian American community. But I think science and medicine are great examples, I think, of places where historically there has been healthy Asian American representation, but you see that dwindle as you move up the leadership ranks. And look, there are various theories as to why that is. There are many of us who, like Victor, were raised to be quiet, and were raised to not speak up unless we were asked a question. And and you compound that with the fact that many of us, myself included, are shy. That doesn't necessarily make it easy to sort of stand out. But also, I think it represents a certain way of looking at leadership, and this goes to a broader issue, a societal issue that's not unique to America, but this is more, I think, a feature of modern society, which is about how we define strength. And too often, I think in modern society, we define strength as the loudest voice in the room, as a person who has the greatest physical strength, the person who can be most assertive with their points of view, and sometimes even at times bowl other people over, with the strength of their argument. But what we don't appreciate, I think, as much is the other forms of leadership, the more empathic kind of leadership, the one that seeks to build consensus, the kind of leadership that values listening first and then reacting later. The truth is we need different leadership at different times, but I think historically, people who are raised in traditionally Asian cultures tend toward a very different style of operating as compared to what perhaps traditional society may describe as strength. And again, I think I don't want to paint too broad a brush here. There are plenty of Asian Americans who are very, very vocal and who are very different from what I'm describing. But I think what that points to, and this is not just a challenge with Asian Americans. Look, I think we've seen this with women as well, who have been underrepresented in leadership positions. And often it's because the great value and strength that they bring in leadership is often not appreciated or I think fully valued in certain workplaces that may be structured more traditionally or that may define strength in the more traditional way that I described earlier. So this, I think, is an opportunity for us to rethink what we value in leaders and to recognize there are different ways to lead and to look closely, as Victor said, also at our data, because the data doesn't lie if it's collected accurately and sourced properly, right? And what the data is telling us very clearly right now is we've got a lot of Asian Americans contributing at lower rungs of the ladder in scientific and medical institutions, and not nearly enough represented as you go further up that ladder.
Monica, actually, I have some data because Tom Lee, Kelvin Vogt, Vivian Chung, and myself have written a paper for New England Journal of Medicine Catalyst. It's been accepted. It will be coming out very shortly. We looked into this. First, let me provide you a little background. They call this the bamboo ceiling, but less than one studies shown that less than 1% of CEO of major corporations are of East Asian descent. And if you look at the Bay Area, particularly in the tech world, where 50% are Asians, 3 times white people are in fact CEOs. But in healthcare, which is what Vivek's talking about, we now represent 25% or more of the student population, and yet 6% of healthcare leaders, right? So Russell Reynolds, which is a executive search firm, actually wrote about this. They say that leadership, C-suite in the United States, I looked at, there's two qualities, what they call loud and soft. Those qualities, loud, which is risk-taking, heroic, and galvanizing, and soft is pragmatic, reluctant, vulnerable, and connecting. That's certainly a bias of what we believe is good leadership qualities, which is more the loud quality. So I agree with Vivek, and I would say that, I have adapted. I guess I can be put into the loud quality, but I can tell you I was very different. And that's an adaptation issue. But should it be, is it the right thing to do? You can debate this. But at the end of the day, I can tell you, when I first went to Duke as CEO, 25,000 employees, people did look at me and say, and I had people who said to me, you're too different. You don't share some of your personal stuff, which Asians don't. Personal family stuff. You're not as open. And then we did a Myers-Briggs analysis of leadership, and I got introvert. So I look back and say, how did I end up with introvert? Because Myers-Briggs asks you to say, what's your first reflex response to this question? And my reflex response is still very much brought up in my culture and my upbringing. I would do this, but I've compensated for it by doing that. It's a really interesting lessons to be learned for younger people where we want to be. I think there's room for both. Clearly, sometimes, inspirational leadership, galvanizing is good, and other times it's really good to be vulnerable and connecting, right? But to use one form of judgment, which is judged by the majority, that's why we choose you as a leader, I think that overlooks a lot of important qualities that many people have. And that, I think, Vivek, is at least the paper we wrote about the question about stereotyping of traits of leaders and why it is possibly the way it is.
Well, I hope that you remember to send me the paper once it's published, where you can send it to me. It'd be great to read it, because the points that you make are very well taken with regard to leadership and what a leader looks like, sounds like, and behaves like, and how that can differ based on phenotypic characteristics, among other things. I'd like to move us to maybe one more topic, and then we'll check and see if there are questions from the audience. So, Dr. Murphy, let's talk a little bit about an area which we know is important to you. It's important to both of you, and that you've written extensively about. There are reports that physical distancing, other lockdown measures have exacerbated anxiety, loneliness, mental health issues due to COVID. What are your thoughts on how to deal with mental health challenges, and what measures can you suggest, especially for Asian American and Pacific Islander communities and other racial ethnic minoritized communities where there's a stigma associated with seeking help for mental health concerns?
Monica, it's a timely question, because during this pandemic, the rates of anxiety and depression have increased in our country, and there are many people who have also struggled with a greater degree of loneliness and a sense of isolation in their lives. And this is compounded by the fact that there is, as you said, this unfortunate stigma around mental health concerns and even around loneliness more broadly, and some of this is accentuated in communities of color. I mean, I still remember growing up, and in my extended family, we had an uncle who was really struggling with depression, and in my first real experience with mental illness, I still remember being in high school and receiving a call from his roommate that he had taken his life, actually, in his house, and it was painful to go through. But I remember in the aftermath of that, while my immediate family, my parents, were very open about how we discussed that, there were many others in my extended family who said, let's not tell anyone about this, because not only will people look at us badly, but other families may not want to marry into our family. That was a big thing. And for those who are either from Indian American families or no Indian families, that's a very big deal in terms of your family being marriage eligible. And so that was a real concern. But look, I think in this moment, more people have experienced, I think, that depression, anxiety, and loneliness than perhaps in any more recent time. And that gives us an opportunity to talk more openly about this shared experience, to be honest about the fact that struggling with depression and anxiety is not a sign that you are broken. It's a sign that you are human, you're having a very difficult experience, the way all of us do at various points in our life. There are some things we can do that I think will be very helpful. I think number one, I think we have to recognize that our connection with one another, our relationships, are an extraordinary source of not just joy, but actually of health, physical and mental well-being. And when people struggle with loneliness, it increases their risk for depression and anxiety, and the flip is true as well. And so in this moment, I find that there are certain simple but powerful practices that can help us to strengthen that sense of connection and hence address some of those feelings of depression and anxiety that may come up from time to time. Spending, for example, 15 minutes a day, making sure that you are reaching out to people you care about. Maybe it's just a simple message to say, I'm thinking about you. Maybe it's a phone call to talk to a family member, a good friend. That can make an extraordinary difference when done consistently. The second is to realize that the quality of our time with others matters as much, if not more, than the quantity of time. If you're like me, you've probably had many conversations in recent years where you are multitasking, talking to a friend, you're catching up, but you're also flipping through Instagram or refreshing your inbox or clearing out a quick email that you think doesn't really take much mental bandwidth and convincing yourself you can still focus on the conversation.
Too often.
Yeah, and I've done this too. All of us have. It's just it's part of living in an era where these devices that we have are just extraordinarily easy to use, and they're in our pockets. They're very available. But the data is very clear that we can't multitask as human beings. What we do is we rapidly task switch from one to another. What that means is that when you might think that you're listening to your friend when you're actually typing out an email because you can recall the words that they're saying, but you're not processing the nuance with which they're saying it. You're maybe missing out on some of the tone, which is so much of how people communicate, not just through words, but through these other ways. And so if you had the experience though, of having a conversation with someone where they were listening deeply to you, where they were fully present, where you and they were both sharing openly, then you know that 5 minutes of that kind of conversation, it can be more powerful than an hour of distracted conversation. So one of the greatest gifts you can give people is your presence, your attention. The third thing I will just mention is the power of service. At times when we feel disempowered, when we feel anxious, depressed, and lonely, seeking out opportunities to serve others can be one of the most therapeutic things that we do. And this was a realization to me just a few years ago. But it turns out that when we serve others, and service, keep in mind, is not just volunteering in a soup kitchen or volunteering for Habitat for Humanity. Service can be dropping food off to a friend who's struggling, pausing to actually ask how someone is doing, and then waiting to actually hear the answer. It can be offering to virtually babysit for a friend who might be struggling to telework while homeschooling their kids, and even just 10 minutes of relief can be a big deal. There are many ways we can serve, but when we serve other people, we not only help them and form a connection, but we remind ourselves that we have value to bring to the world. And this is one of the great prices of loneliness, depression, and anxiety, is it can rob us over time of our self-worth. It can make us feel that we have no value to bring to the world, and service reminds us of that. So these are some small, simple things we can do to strengthen our sense of well-being. But finally, just remember, each of us who speaks up about our challenges with mental health or loneliness, we make it possible for others to do the same. We give people permission to stand in strength when we do the same. So I just want to remind people of that, as hard as it is, given the stigma that we have. Many of us are going through very similar experiences, including myself, at times as well. It's nothing to be ashamed of. It's something that I think, if approached the right way, can bring us together and help us strengthen one another.
That's fantastic. I think I made all of those notes. We only have 1 minute left, so I'm actually going to give the last word here to Dr. Zhao, our honoree, with a question from the audience that I thought was really important, and we'll wrap with this. How can public health leaders continue, you mentioned trust, how can they continue to build trust within our country and across the world? Big question, 30 seconds.
Sure, 30 seconds. We need to be clear in our communication. We need to recognize that when we don't know an answer, that we don't know an answer. We need to be always adaptive and being able to tell people when new evidence emerge that this is what it is. I think a lot of mistrust is a misunderstanding of public health people saying things that is kind of speculative, not based on data, or that it leads to people to saying that is the fact that you just told us, and then 2 weeks later you tell us something differently. Even the issue of wearing a mask or many others. So I think public health leaders have to be based on science. They have to be able to acknowledge what they don't know and what they do know. They need to communicate consistently and clearly. And then they should always put the welfare, health of others above their own needs.
That is fantastic. I really, as we wrap up this session, very fascinating, very thought-provoking. On behalf of the organizers of this event, I extend sincere thanks and gratitude to both of our guests for taking time out of their very busy schedules to be with us today. We really appreciate it. I also want to thank the planning committee at the NIH FAPAC chapter and the other AAPI groups at sister federal agencies from FDA, CDC, HRSA, who worked hard to put this event together in a short time. And thank you to the viewers for joining us today. Take care.
Thank you.
Thank you so much. Take care.
Thank
everyone.
you. Great to have a conversation with you.
Yeah, I
Thank
love
you
it.
for a wonderful, wonderful conversation. I enjoyed it thoroughly. Thank you, Victor, and thank you very much, Vivek.
Thank you, Eliseo.
And Monica, you were fabulous. You have a future.
Oh, yes. It was terrific.
Thanks. It
I
was
was
fun.
blown away how you kind of synthesize everything we said.
So
you know.
nice.
It's just amazing.
Thank you. This was fun. I learned a lot and I enjoyed it. Didn't get to all the questions. I knew that would happen. There's so many more interesting things to ask about. So thanks for allowing me to moderate this conversation. It's really great.
We'll have another one next year, right, Vivek?
Yep, another one next year. We'll look forward to that.
All
In
right.
person next year.
I hope so.
All
Take
right.
care.
Take care, everyone.
Thank
Thanks
you.
so much again.
Bye-bye.
Appreciate it.
Bye-bye.
Thanks.